As the nurse, it's important to be willing to have sessions for your parents on letting them come in and ask any questions that they may have for toilet training. It's also beneficial for them to be with other parents and hear other parents' questions. So today we're going to show you a little simulation of some parents asking the questions to a nurse, which can show you how those sessions may be able to go. Hi everyone, my name is Riley and I will be teaching the course today on Toilet Training 101. Thank you for coming all the way to the hospital for this course. This is an important topic. Toilet training is a difficult time in a child and a parent's life. It can come with many ups and downs, but I urge you to stay strong and continue to reach out to your healthcare team once you actually start the process with any other questions. I'm here to answer any questions or concerns you may have right now, starting to toilet train your toddlers. Then, after I've answered some of your questions, I have an informational video for you to watch which will hopefully help you to feel confident to begin this journey. So let's start off with some questions you may have right off the bat. Yeah.
So my child is 4, and he's still not potty trained. So I was just wondering if he's supposed to start changing his diaper on his own, or using the toilet on his own when his diaper is dirty, or I don't know.
That's a really good question. So the answer is no. Although he is older, on the older edge of toilet training, I wouldn't worry about that at all. It will happen when he's ready, but you do have to put in some measures to show him that that's something that we need to take this step to. So a child will notice that it's easier to be in a diaper than to go to the bathroom, even though they may not really like the feeling of a wet diaper. So a good sign to show that a child may be ready is if they start giving you like the diaper and be like, "Mom, I'm wet. Can you change me?" Okay. That's a good sign to show you that this child needs to start potty training, because they're definitely aware when they go to the bathroom.
Okay, thank you.
Mm-hmm.
I have one more follow-up question. So is it true that boys are harder to potty train than girls?
Yeah, so you hear that a lot, that boys are harder, but girls tend to be ready earlier to potty train, but that doesn't necessarily mean that they're easier. Boys may take a little bit longer to get the hang of it and to really understand like what they need to do when they go to the bathroom. But on the other hand, boys can also go anywhere and any time, and it's much easier for them to go once they get the hang of it. So it can go either way with it, but it mostly just depends on your kid, not really their gender.
Okay, thanks.
Yeah.
So I have a question.
Yeah.
My wife is 4 months pregnant right now, but we also have an 18-month-old child. So do you think that I should potty train my 18-month-old right now so we don't have to deal with 2 kids in diapers?
Yeah, I get the concern of having 2 kids because diapers are expensive, and it'd be really helpful if you didn't have to change 2 kids' diapers. But unfortunately, kids tend to, older siblings tend to notice that they lose attention once a new baby comes. So I'd recommend waiting until your family's well adjusted to the new baby before you start to potty train him. Because your child is on the younger end of a toilet training, so there's many more years you have. So I wouldn't push that, and I'd just wait. So if you ever have a child coming on the way, I just wait until after, because you don't want the stress of, okay, my child's potty trained, but then after the baby's born, then they go back. And so you can have to retrain this kid, and that can just cause a lot of stress.
Okay, thank you.
Mm-hmm.
I had a question.
Yeah.
So my little man has been peeing the bed at night.
Okay, that's hard.
It is. I was wondering if you had any advice for me on that whole situation.
Yeah, so going to the bathroom at night is a hard thing because you change the sheets a lot, I bet, and all those things. So, like most children, your toddlers probably take a little bit longer to complete nap time and nighttime toilet training. We encourage your toddler to use the potty immediately before going to bed and as soon as he wakes up. And then tell him if he wakes up in the middle of the night and needs to use the toilet, he can either go by himself or call for you to help him, as well as sometimes it's better to use pull-ups when you go to bed, when you put him in bed for a nap or overnight, just so then they're a little bit less than a diaper, but they'll prevent your bed from getting wet.
Okay. Thank you.
Yeah. Do you guys have any other questions before we start the video?
I don't think so.
Okay, so now we're going to watch this video, which will most likely answer some more questions or show you some things that you didn't think about that will answer questions while you're watching the video. This video will show you a child who is too young for potty training, a child who is too old, and then a child who's in the optimal age. and what that looks like when you're in the bathroom, and you'll notice the stress level when a child is ready is a lot less than a child who is either too old or too young. And this will hopefully provide even more insight on signs to watch for with your child and allow you to mentally prepare, because it is a big thing with the parents. Parents need to be mentally prepared to do this task. So hopefully this will help.
Great.
Yeah, and I'll just start it up over here. In the toddler age group, 12 to 36 months, toilet training is one of the biggest milestones. In this video, we will be showing you effective and ineffective ways to toilet training. Mira, do you want to go to the bathroom? Do you want to go to the bathroom? That sounds like a yes to me. Come on, let's go. Come on, let's go. Come on, let's go this way. Let's go this way. Oh, okay. Come in here. Come in here. There you go. Yeah. Just sit on the toilet. Sit on the toilet. Come on, let's sit on the toilet. Let's sit on the toilet. Come here, Mira. Here, I'll help you. Okay, sit on the toilet. Alright, now go to the bathroom. You go to the bathroom? Mira, why don't you want to go to the bathroom? Why not? This is so hard. Come on, Mira, let's try again. Okay, go to the bathroom. Okay. Okay.
A nurse should make sure to inform the parent on the importance of recognizing the child's readiness. In this video, Mira was clearly not wanting to go to the bathroom and was forced into the bathroom. It is important not to force a child into going to the bathroom because this could result in the child being afraid of using the restroom. Parents need to know that it is not a competition, and every child is different. So for Mira, the parents need to be aware that it is okay to start training even if their friends are training and their children who are the same age. In regards to mental readiness, this child is clearly too young to express any interest in toilet training. It is important that a nurse educates a parent that if a child has no interest in toilet training, then they are most likely not ready. Psychological readiness is not complete until about 24 to 30 months. Parents should begin preparing their children for toilet training earlier than 30 months. Girls are developmentally more ready than boys at an earlier age. Nighttime training takes much longer than daytime because their sleep cycles need to be more regular for this to happen. There are 6 psychological signs that show a child is ready to start potty training. These include pulling at a wet or dirty diaper, hiding to poop or pee, showing interest in others' use of the potty or copying their behavior, having a dry diaper for a longer than usual time, awaking dry from a nap, and telling you that they're ready to go, or are going, or have just gone in their diaper. Additionally, it is important to wait until the child wants to go, because this is the age when children typically enter a phase referred to as negativism. This is when the child realizes that he or she has power in a social relationship and is compelled to test the limits of his or her newfound power. Their favorite word can now be no, and they take delight in refusing any and all requests and instructions from their parents. Parents need to portray that it isn't a big deal to them because then the child won't feel they need to rebel. As we can see in the previous clip, Mira is not displaying physical cues about needing to go to the restroom. This would include things like using words, facial expressions, movements, or indicating the need to urinate or defecate. A mastery of gross motor skills is important so the toddler is confident and able to make it to the toilet when needed. These skills would include skills of sitting, walking, squatting, and a strong grasp of fine motor skills is also important, which would include removal of clothing. Having a toddler plant their feet firmly on the floor facilitates defecation. If they are using a toilet at home and are unable to reach the floor, a stool may be needed to help them. Having voluntary control of anal and urethral sphincters usually takes place between 24 and 30 months of age. This is one of the most important steps in toileting. Primary nocturnal uresis occurs in 20% of 5-year-olds and 10% of 6-year-olds. Thereafter, spontaneous resolutions of enuris occurs at a rate of 15% per year. The evaluation for primary nocturnal uresis should include a family history, complete physical examination, and urinalysis or urine culture depending on initial findings.
Mom, I got pee.
Oh, are you serious? Okay, let's go.
How do I do it?
Okay, the first step that you need to do is you need to pull down your pants.
Okay.
Okay, now you need to, no, don't start peeing yet. You need to put the toilet seat up. Oh no, it's too late for that. I thought that you knew how to pee.
Mom, you gotta teach me how to pee. All the kids at school make fun of me because I don't know how to go.
Oh, well, we've been working on this for a week. Maybe we can work on it another week and you'll get it figured out.
Can I get some Cheerios?
Why do you need those?
The nurse should educate parents to make sure that they commit enough time to toilet training their children. In this scenario, it is clear that the child knows what is going on, but has not been taught what they need to do when feeling the urge to use the toilet. When providing education to the parents, the nurse needs to make sure that they commit and inform all caregivers that the child is toilet training. Since this child is so old, communication should not be an issue. Parents need to make sure that the child knows to tell them when they have to go to the bathroom. Along with that, it is important to always remind the child to go to the bathroom before leaving the house and going to bed in order to prevent accidents. As nurses, we should encourage parents to teach their children to potty train before they enter school. According to Eric Erickson, children of toilet training age are in the second stage of development, known as autonomy versus shame and doubt. If a child is unsuccessfully potty trained during the years before they go to school, they'll develop a sense of shame and doubt that will eventually lead them to having a low self-esteem and lots of insecurities, growing up overly dependent on others, doubting themselves in accomplishing tasks, and criticizing their own abilities. At the same time, do not force a child who is not ready to start potty training. The child is also clearly physically and mentally ready to be trained. As stated before, a child is ready around 18 to 24 months.
Okay, let's go. Come on, let's go in here. Let's go in here. Do you want to go to the bathroom? Okay, can you go to the bathroom, Kobe?
I said B.
Yeah, let's go. Let's go. Can you go to the bathroom? Good job. Good job. Can you flush the toilet now? Flush the toilet.
It's okay to flush the toilet.
Yeah, go ahead.
Pretend to flush the toilet.
There you go. Good job, Kobe.
It's gonna get clogged.
Okay, now, Kobe.
It won't get clogged.
Rub them together.
This is a 3-year-old boy. But
Okay, wipe your hands off.
In this scenario, the child is ready to toilet train. The nurse can educate the parent that this child is ready to use the bathroom. Some positives in this scenario include that the parent had a toilet seat for the child, which provided a sense of safety, and also the mother did a great job of providing positive reinforcement. Through providing him with a prize, she rewarded him for behaving correctly and made the child want to come back and repeat the same actions. Furthermore, the parent provided proper education on hygiene and how to clean up the bathroom when finished. The child also displays signs of mental preparedness for toilet training, as evidenced by independence, control of functions of elimination, and cognitive skills to follow directions and imitate appropriate behavior. It is important that the nurse informs the parents about these specific signs to look for when determining if their child is ready for toilet training. Furthermore, the child is displaying that he is physiologically ready for toilet training by expressing interest in actually wanting to be potty trained. The child expresses a willingness to please the parent by having the ability to sit on the toilet for 5 to 8 minutes, being curious about adults or older siblings' toilet habits, and being impatient with soiled or wet diapers.
We interviewed Miranda Elliott, an OB charge nurse at St. Peter's Hospital, about toilet training. She touched on all 4 aspects we discussed: the physical, mental, psychological, and parental readiness. However, she specifically stressed the importance of teaching parents that nothing matters more than the child being interested and mentally ready, as well as the parent being mentally ready. Miranda talked about the reality that parents tend to want to speed the process up once children start eating real food, but it is important not to force the process, as that will lead to frustration of the parent and a bad experience for the child. As a nurse, Miranda talked about how important it is to give positive feedback to the parents and let them know that toilet training will pass and this is just a phase. After talking to Miranda, there's a clear role that the nurse has to provide encouragement to the parent as well as help assess the child to see if they're ready for toilet training. As you have seen, the nurse's role in making sure that toilet training goes well is very important. If the nurse can provide education on the physical, mental, psychological, and parental readiness mentioned in this video, then toilet training experience will go much smoother for both the child and the caregiver.